accident that happened yesterday. And we can speak to Julie Riggs now, who's a consultant with Phoenix Health and Safety. So you would advise companies on complying with the law, Julie?
Absolutely, Jeremy, and good afternoon to you. And I think sort of echoing similar sentiments that most of your callers have about regarding such a tragic event as well to such a young life. But yes, we're very much involved in looking and trying to have a very sensible management regarding risk and trying to sort of create events where people can actually still go along and enjoy themselves, but hopefully trying to stop these tragic events from happening.
But if there is risk, they may sometimes happen, may they not?
I think there's a level of understanding risk, and of course that creates a conversation about what a perception of a risk might be, and we've seen that in extreme forms where perhaps we've seen levels where children are issued goggles to play conkers, but we also see it in quite high-risk types of activities and sports and activities that we see around the country. And of course, those types of activities are often very closely managed, very closely risk assessed, so that we can try and identify what those hazards are, trying to prevent such accidents from happening.
Yeah, but there's a lack of logic in there, isn't there? Because if you have risk, you cannot prevent all accidents, and there are some activities where there will be risk by their very nature, and you brought in sport, so skiing down a mountain is one, having knives thrown at you as part of a circus act is another, being fired out of a cannon is another, going on something called the wall of death, which is in fun fairs now where motorcycles go round inside a cylinder, is another. And you can have as many inspectors as you like to inspect it, but it doesn't make it safe, does it?
Well, it's quite interesting, and I think also Graham talked about the inspectors haven't quite turned up to the incident yet to investigate, and that's a clear indication that actually the number of inspectors in the UK are decreasing, and we're having to rely very much on local event planners, local organisers to actually understand the level of risk that's involved and how they actually evaluate those risks in a sensible manner and ensure that we are trying to control it as successfully as possible. But it relies a lot of local competency knowledge, and that now is being transferred very much to the local event organisers as opposed to local authorities and the HSE.
But at some point, somebody has to sign off on something that is inherently unsafe, don't they? There will always be a lack of safety in an activity like this.
There is always a degree of risk involved, but how much can that be controlled? I'll give you an example of that, Jeremy, if I might. If you just might indulge me for a second.
No, go ahead. Yeah, it's fascinating.
Well, we have in the Moscow State Circus, which actually were in Liverpool in 2009, and we had a clown that was performing an act where he was on the high wire, and he was doing quite a spectacular event where he was walking through hoops of fire, and he was playing a drum kit, trumpet, and double bass at the same time whilst he was doing this. And unfortunately, during this act, he actually fell from the wire, which was about 3 meters high. It resulted in a broken bone in his left foot. And there was outcry at the time as to whether this should be allowed to happen, and actually should we perhaps ban clowns from performing such acts, or I think at the time his clown shoes were attributed towards the accident. And of course, that isn't the case at all. We need to look at it sensibly and say, well, actually, what can we do to prevent that risk at source? And if we can't, then how can we prevent consequences from that?
What about knife throwing? I mentioned that because I was at a fair a couple of weeks ago and there was a knife throwing, and I didn't see it happen, but it was one of those ones where somebody, it might even be a volunteer, is strapped to a wheel, and the wheel is spun, and then somebody throws a knife at them.
Yeah,
now, how can an HSE...
I'm not quite sure how you would control those types of risks.
Exactly.
Yeah, those types of risks are very extreme. I mean, when we're talking about sort of high wire types of acts, or we're talking about, in this case, with a cannonball, very much part of that was controlling the fall part, which was the failure there, and clearly something went wrong in that type of control mechanism. But throwing knives, just such an extreme level of activity that's involved. I'm not quite sure how you would eliminate those types of risks that would be involved in that. So certainly there would be a concern from that point of view. And I think event organisers need to be able to look at that and understand, actually, is this a risk that we feel comfortable with? And do we actually feel the person is competent and they have evaluated those risks? That's very difficult to do with such a dynamic type of activity that's going on that can be subject to so many different variants with that activity.
Thank you very much, Julie. All the best. Julie Riggs, consultant with Phoenix Health and Safety. We're talking about the sad death of the man who was the human cannonball.